is the Emergency Medical Minute.
Okay, so we see a patient comes in with lower abdominal pain. She's G2, P2, about 4 months postpartum. Her pain's suprapubic. It's severe. She feels it radiate to her back. You examine her. You don't feel much anywhere else, but maybe there's a kind of a suprapubic mass. She gets a pelvic exam. She's had no vaginal bleeding or discharge, no urinary symptoms. She gets a pelvic exam, maybe an enlarged uterus, some tenderness over the uterus, but no discharge. Lab work, completely normal white count, normal urinalysis. You opt to do a ultrasound, and ultrasound shows a distended uterus that's it's filled with fluid. What do you think her diagnosis is, or what would you think about? So this is something you don't see that often. It's hematometra. So basically, the uterus is distended, full of blood, and is obstructed. So she's had no vaginal bleeding. Hematometra is when the uterus is filled with blood due to obstruction of the lower reproductive tract in women. It can be at the level of the uterus, at the level of the cervix, or even in the vagina. Typically, you hear about this in adolescence. The most common causes is congenital causes, so imperforate hymen, some vaginal transverse septum, some vaginal hypoplasia, and typically you'll hear about cyclical pain, abnormal bleeding in young women around menarche. A lot of it's not complete obstruction, so they'll have some bleeding, and that's when it's more difficult to actually diagnose. But you can actually get acquired hematometra as well, which can happen from cervical stenosis. It can happen from uterine adhesions inside the uterus. It can happen with endometrial and uterine malignancies. You can see it after surgery, like DNC in childbirth. And in fact, I think some studies show that 1% to 2% of all uterine surgeries can end up with some degree of hematometra. How do you diagnose it? So first of all, the symptoms. They have pain that can be cyclical, abnormal bleeding. You may palpate an enlarged uterus. A lot of these patients will actually, if they're really obstructed and really uncomfortable because of the uterus being really distended, they can actually be vasovagal, be hypotensive or bradycardic as well. Typically, the history, the exam, and usually an ultrasound will give you the diagnosis. Sometimes you have to do a hysteroscopy as well. And then the treatment is surgical. You want to repair the obstruction, so cervical dilatation, hysteroscopy to lyse the adhesions inside the uterus, or fixing the congenital abnormalities. In our patient, she had some degree of cervical trauma from her first pregnancy that caused some abnormal bleeding that she had to have a procedure for, and then following this last surgery, this last childbirth, she had re-stenosis of her cervix and had a complete obstruction, so she went to have cervical dilatation.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.